Welcome, welcome, welcome. You are now tuned into the Hip Hop Caucus Rona Roundtable. Thank you so much. Thank you so much for being here. I am Terrence Muhammad. Some people know me as TC, and we're so grateful that you are here for this great conversation in the midst of COVID-19. And we're excited for you to be here. And we can't wait for more people to join us for this powerful and moving conversation. So we really thank you for being here. We want to make sure that everybody's engaged. There'll be time for you to go through the chat and ask questions of our expert panelists, our wonderful panelists, and we thank them for coming on. And yes, we're living in a different time. You know, we're living in a world where we're not able to be physically in the same space, but we definitely want to socialize with one another. I know there's the thing called social distancing, but tonight we want to be socially close to one another virtually as we share this wonderful information, as we share this wonderful experience tonight. And once again, I'm Terrence Muhammad. I'm the Community Outreach Manager for the Hip Hop Caucus, and please check us out, hiphopcaucus.org. And we can also check us out at think100climate.com, think100climate.com. And you can learn all about the wonderful things of the Hip Hop Caucus, the things that we're doing, all of the years of being out there in the community. So we want to share these conversations that we're going to have tonight with you. This is birthed out of a conversation with a lot of our leadership committees across the country that felt that we wanted to make sure that we shared it with you, all of our guests that are here tonight on Zoom. So we want to go ahead and kick it off, and we thank everyone who's on Facebook Live, tuning in, all that's on the Zoom. Make sure you let everyone know we're here and we're here for you. But right now, we want to hear from that inspirational, motivational person, our president, our founder of the Hip Hop Caucus, Rev Lennox Yearwood Jr., who is going to start us off, get us right, and he's going to give that wonderful welcome and thanking you for being here. So we're going to turn it over right now to our president, Rev Lennox Yearwood Jr. Thank you.
Thank you, TC. I appreciate you and the entire team at the caucus for pulling us together. I appreciate all of the leadership committee members across the country. This is a very difficult time. I have to start by saying that we in this country have now come close to or about to eclipse the deaths of 85,000 people. 85,000 people, not over the course of 8 years or 8 months, literally over the course of 8 weeks. That is staggering. You really have to pause to understand the magnitude. I was just kind of thinking through that literally that means in some cases, and it's more, but that's like, it's even to say 40,000 people passed away in a month, 10,000 people in a week, several thousand people in some cases in a day is staggering. What's more staggering is that the percentage of people of color who have passed away is disproportionate to the amount of people of color living in this country. And so when you look at that number on top of it, that it's not only just almost 85,000 people, but you have this tremendous amount of people who are Black and brown and red who are dying at astronomical, historic numbers. And so I think for us at this time, we have to pause. I think that we have to sometimes just reflect on, for me, and obviously I am a spiritual person, we have to reflect on that we are here at this moment, but even for ourselves, that we saw another day, that we woke up this morning. And just the sheer fact that we got up on May 13th on a Wednesday, and we're here, that just means that we have to just reevaluate our role in this process. That means that because we didn't stop on the 12th or the 10th or in April or in March, because we're here today, we have to then say, why am I here? What can I do in this moment to ensure that I'm literally doing all that I can to help not only my community, not only my country, but this world at this moment. And so I think there's three things that I kind of just want to bring forth, each with the S. I think Jerome would like that because, you know, I guess I'm a preacher, so I guess you have three S's on. That's what we do. I see Dr. Ford nodding her head and agreeing with that. But the first thing I want to say is in support. The Hip Hop Caucus is a vehicle for this conversation. I'm very honored. The caucus turned 16 this year as an organization. That's very important for us as a people when we have institutions that are now beyond 16 weeks or 16 months, but going on 16 years. That's also a part of our culture. This is something that we, Hip Hop Caucus, is that this is ingrained in our culture for our community. And one thing is also, it's not just, even though it's primarily people of color who are part of the caucus, it's Black, white, brown, red, male, female, straight, gay. Humans are a part of this amazing organization. And so I'm very proud that the work that the team has done to bring this together, and we just want to, if nothing else goes forth, we want to make sure we extend to everyone that the Hip Hop Caucus is your organization. If you see something that can be done better, if you see something that can be done that could improve, if you can add your voice, we need your voice. This is a moment where we hope, if nothing else, a Hip Hop Caucus is reflected as your organization. So we want to be a support for our community, but we also need you to be a support for us. The second thing, I guess the second S, is strategy. I'm looking forward to hearing all the experts coming forth, but I couldn't say this part of it as well. Unfortunately, there are folks who are not as sad, not as somber, not as upset by what they're seeing. We have seen, for instance, the Environmental Protection Agency is literally rolling back the provisions regarding air quality and clean water during this time. We're seeing things like what we saw in Wisconsin. They're putting people at risk of voting and putting democracy at risk. We're seeing, because of the physical distancing, we're seeing increased policing being used in our communities. We're seeing with many things happening. We're seeing on the fossil fuel industry and many folks in Wall Street first in line, literally first in line to get a check, and not getting the $1,200 check that some of us have gotten, some of us didn't get, but first in line to get millions of dollars, literally. And so when we see the HEROES Act now coming, the third installment, they now want to stop. They say no more money, insufficient funds. And so we see now that there are folks who are having Zoom calls just like this, but unfortunately they're having Zoom calls to see how they can destroy our communities, take over our businesses, downgrade our institutions, get rid of our communities. So we have to be this. I wish we was all kumbaya. Everybody was on the same page. It was just, we all were fighting to get rid of COVID-19, but unfortunately there are folks who are having this exact same little box on the screen, Zoom conversations, talking about what they can do to dismantle Detroit, what they could do to dismantle New Orleans, what they could do, how they're gleeful that it's mostly Black folk and brown folk and red folks who are dying and not them, how they can reopen quicker. Let's get to churches or wherever we want to get to faster, because they don't see the toll or the hardship. The last thing I guess I want to say, the final S, is in regards to, if there's ever a time as a movement, we need to hear the words of Audre Lorde and have a movement of self-care. Self-care is a revolutionary act. I need for everyone who's watching this via Facebook or via Zoom or watch it later on. I need you to take care of yourself. I know it's hard. I know it's, as they say, you know, you have to have a spirit where you have to have your sword in one hand and build the wall with the other. I know it's difficult to have children at home and be dealing with all kinds of situations from work or school or whatever. I know it's a very difficult moment in time, but I need for us as a people, if nothing else, to be a self-care led movement. I need for us to take care of one another. I need for us to be okay to cry. I need for men to be okay to share. Say, listen, I don't know if I can make it, or our women to be like, I got your back, or vice versa. However it needs to be. I need us to have fun too. I need us to dance. I'm so glad for the artists and the rappers and the poets and the dancers who've been bringing like D Nice, just bringing entertainment into our movement at this time of we having couch parties. We need to have fun at this time more than ever, because if it's not fun, then you're done. So I just want to say that while we must have the support, while we must have the strategy, we must have self-care. So I'm looking forward to an amazing conversation. Thank you all, the experts on this Rona Roundtable, and I'm looking forward to learning from you and being with you and fighting with you and being together. And in the motto of Hip Hop Caucus, we say, can't stop, won't stop, all power to the people. Thank you so much.
Man. Thank you, Reverend Yearwood, for those powerful words. Once again, you're tuning into the Hip Hop Caucus Rona Roundtable, and I was making fun of, you know, we on many Zoom calls all day, and one of the biggest things is like, unmute yourself. But we're not going to be muted tonight. We're going to be heard around the world to hear of this message get out. So we thank Reverend Yearwood for talking about self-care, because I'm going to list our wonderful panelists, and then we're going to go into the first one. But he did mention Dr. Shamell. She's a healer or artist, a community organizer, and I bring that up because that is so much, it's so necessary, because we at the Hip Hop Caucus are making sure that we are taking care of ourselves as we're trying to take care of those or in vulnerable communities. Also, we have Jerome Record, who is part of the Hip Hop Caucus and S.E.E.D. Now, he'll tell you more about that. Straight out of Detroit, representing for the Hip Hop Caucus in Detroit. You'll be hearing from him later. We have Chevonna Gaylor, therapist and speaker and author. She's going to give us some good words later on. We have Yvonne Ford, College of Health and Human Service at North Carolina A&T State University, and also Crystal Dixon, public health educator. These are all of our wonderful and amazing group that's going to be on tonight. And we're going to talk tonight on public health. And I'm going to have them start us off. And once again, you are tuned into the Hip Hop Caucus Rona Roundtable. I am Terrence Muhammad, and we're going to go straight to our first panelist to give you some wonderful, inspiring information. And I guess I'm going to turn it over right now to our good friends, Crystal and Yvonne, and they will start our show.
Good evening. It's great to be here. I'm Dr. Yvonne Ford, registered nurse and faculty at the North Carolina A&T State University. And I think that it's just perfect to start by saying that public health is not new to the Black community. In the 1960s, the Black Panther Party set up a public health response to health disparities related to systematic and systemic racism and lack of access to health care. So we're not in a new space. But there's a lot of misinformation that's out there in digital spaces, such as Black people don't get the Rona. Everybody heard that early on. Only old people are at risk. Children can't get the COVID-19 virus. Bleach or alcohol should be applied to your skin or taken internally. Please don't do that. COVID-19 is just a bad flu. That's false. Face masks always protect against COVID-19. Antibiotics kill the coronavirus. They do not. It's a virus. Antibiotics work on bacteria. You can catch COVID-19 by eating Chinese food. You cannot. And something that's been out there as a conspiracy theory on a lot of digital spaces is that 5G helps spread the virus. That's not how that works. And then also the vaccine, when available, should not be trusted. Well, let me tell you, all of that information is false. None of these items are true. They circulate on social media, YouTube, and other digital spaces. So I want you to arm yourself with reliable information. So where are some places that you can find reliable information? Johns Hopkins University Coronavirus Resource Center. This site has information based on science and the health of populations, which is us. And they update their statistics. There's a lot of information. As of 1 o'clock today, these are the known statistics, and they have increased since then. Another place that you can find reliable information is the Centers for Disease Control and Prevention, the CDC. They have good information, although they appear to have been constrained by the political atmosphere. Their mission is public health. And also your local health department is also a good place to find reliable information. And the CDC works with those local health departments. So how can you keep yourself and others safe? First of all, wash your hands with soap and water and don't touch your face. This is what we teach nursing students on day one. Wash your hands when you return home, when you go get the mail, and other contacts outside of your home. You can use hand sanitizer, but I would say every 4 or 5 times that you use that, you need to wash your hands. And there's a lot of information on the internet on how to properly wash your hands and get every surface so that you decrease your chance of contracting COVID-19. How else can you keep yourself and others safe? Cover your face in public places. I thought this was really interesting. I'm an emergency nurse, so I have a weird sense of humor, but there's something called the urine test. So if we all run around naked and someone pees on you, you get wet right away, right? If you're wearing pants, some of the pee will get through, but not as much, so you're better protected. If the guy who pees is also wearing pants, the pee stays with him and you don't get wet. That's the logic behind wearing masks. And it doesn't give you the protections that maybe healthcare providers have, but it can help keep you safe, help keep your loved ones safe. And gloves, if you're using gloves improperly and you're contaminating them and touching your pocketbook, eating your lunch, don't do that. It's better to not have gloves and wash your hands. How else can you keep yourself and others safe? Practice social distancing. This is the famous bad attitude cat. And the woman says, I wasn't even that close to you. He says, 6 feet, Karen. They said 6 feet. So maintain 6 feet of distance between yourself and members of the public. Be aware, especially of those behind you, and make sure that they give you 6 feet in the rear as well. Clean things that come from outside of your home. In my house, we wipe down groceries with antibacterial wipes, let them stand outside for at least 2 minutes, and then wash our hands for 20 seconds before bringing that food inside. Washing produce, you should wash produce with water before eating, but you don't need to use disinfectants, cleaning wipes, or soap on produce. Again, frontline workers, I know that you're out there and you have no choice but to go out. Cover your face. Practice social distancing in public. Demand personal protective equipment or PPE. If you're a frontline worker, you should have, at the minimum, a mask so that you decrease the chance of transmission. Wash your hands as often as possible. And again, ideally after 4 or 5 sanitizer uses. excuse me, if you're sick, stay home and call OSHA, Occupational Safety and Health Administration, and that's OSHA.gov. Thermometers, something that everyone should have in their homes is a thermometer and a pulse oximeter. It can be a $5.99 thermometer, excuse me, from your drugstore, your grocery store. It can be a fancy forehead thermometer if you can afford that. And my husband told me at the beginning of the pandemic that he has a heat-seeking apparatus out in his toolbox that he could use if we needed to. Pulse oximeters are important because we have found that people have decreasing levels of oxygen and your body adjusts to that until it can't. And so pulse oximeters can give you an indication of the amount, excuse me, of oxygen that you're getting around to your body tissues. Ideally, it should be 95 or greater. If you notice that it starts dropping, this pulse oximeter is like $20. There's some other fancier ones, but keep yourself safe that way. This is not the COVID, I'm sorry. If you're symptomatic, get tested. So what are the symptoms? Shortness of breath, cough, loss of smell and taste, fatigue. And there are other symptoms that keep coming up on a regular basis as we know more about this disease. If you're exposed to someone positive, get tested. If you're living in close proximity to others, because sometimes we don't have a choice, look for symptoms not only in yourself, but in them, and encourage them to seek care. If you think you had COVID-19 symptoms earlier, December, January, February, get an antibody test. And check trusted websites to keep up with how you can get tested in your community. Finally, protect your mental health. There are a lot of things we can't control, and we need to let those go. Things we can control and need to focus on is having a positive attitude, turning off the news, finding fun things to do at home, how you follow CDC recommendations, you can control that. Limiting social media, doing your own social distancing, and standing in your kindness and grace. So finally, I put this graphic up. We will persevere and become better together because that's what Aggies do. Aggie Pride.
Thank you, Yvonne. As y'all can see, you know what school she goes to. But we want to move along to our next health presenter, Crystal Dixon. Crystal? You can go ahead now. And remember, you can ask questions in the chat.
Great. All right, you can hear me, TC? Great.
Yes, we can.
All right. Thank you so much for having me again. I can't express my gratitude enough to be on this incredible platform. I really respect all the work that the Hip Hop Caucus has been doing, particularly with environmental justice. So I want to start off by talking about a definition of racism. And, you know, one of our, you may know who she is, but racism, let me back. I want to start by saying that this pandemic is not your fault. And I think it's good to really set that tone, because what we're seeing is a system of white supremacy operating in a way that is thoughtfully intended to operate. The system is doing what it's designed to do. And I recognize that, you know, there are a lot of data out there that's misleading, but I want to talk with us about what's really happening. And so Dr. Kamara Phyllis-Jones defined racism as here. I'm going to read it because it's so powerful, but racism is defined as a system of structuring opportunity and assigned value based on the social interpretation of how one looks, which is your race, that unfairly disadvantages some individuals and communities and unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. That's relatively a loaded comment, but she's saying a lot there. And Instead of addressing how decades of structural racism and political exploitation and economic exclusion has compounded health and wealth disparities in the Black communities, the American habit has been to trivialize those inequities as a result of individual behavior. So as a public health professional and health educator, I would argue that there are systemic issues happening that's creating these inequities, and we all can agree to that. As Yvonne mentioned, this is nothing new. Booker T. Washington and the U.S. Public Health Services in the 1930s established the National Negro Health Week to really address the tuberculosis outbreak among Black people. And so I applaud everyone who's continuing that legacy today. The Harvard study also mentioned that this was about a month ago that confirmed significant relationship between COVID-19 fatalities and other conditions related to long-term air pollution exposure. So it showed that those who have lived in places with significant air pollution are 15% more likely to die from COVID-19, right? So this is outside of personal choice, all right? So the system is designed to strategically expose us to lethal environments through geographic placements, structural barriers, and misallocation of resources. So it leads me to my next point, that racism is a pre-existing condition, right? So Black communities have disproportionately been impacted by COVID-19, as it was mentioned earlier, and African Americans are 75% more likely to live in places bordering polluting facilities like a factory or refinery compared to other Americans. 78% of African Americans are also living within 30 miles of a toxin spewing coal plant, right? And 71% of African Americans live in counties that violate federal air standards, right? So this is is just terrible. And so your zip code is a better predictor of how long and well you will live than your genetic code. So I want to go ahead and just kind of debunk some things that are stated that it's your fault, and it's not your fault. These are things that we're up against regularly. And as my friends in the Greensboro Health Disparities Collaborative has shown, that access to healthcare is still not enough, because once you get into the system, you're treated differently, you're given different quality and standards of care. And we're seeing that in COVID in terms of the testing. So I want to just throw some stats out here a little bit, and it was a great introduction to our panel today, but just a few states here that I want to mention. That when the pandemic hit, elderly white people were over the age of 65 or 55 were at highest risk, so much that a false narrative that Black people couldn't get COVID-19. But on April 7th, major outlets began reporting that preliminary data showed that Black and Latino Americans were being disproportionately killed or affected by the virus. So in my opinion, as soon as the demographic shifted from the elderly whites to minorities, states begin to open, right? So here's some data here. Illinois, Blacks are dying from COVID-19 5 times the rate. Louisiana, they're only making up a third of the state, but 70% of them are getting it, as well as Georgia. So we've saw Georgia, right? Georgia is recent, and interestingly enough, one of the Blackest states in the country is the first to open, right? And also there are now 80% hospitalizations are happening in their Black people. So this is structural racism. It's a system of white supremacy doing what it's designed to do with policy structures and withholding of resources, which is clearly defining of us our civil rights. So we have to get in positions to fight against that. The Hip Hop Caucus has been doing phenomenal work addressing environmental justice. And I want to lift up sustainability as well, and they've been talking about cleaner energy. But this photo happened during the pandemic in Little Village, Chicago, after a coal plant smokestack was demolished in the middle of the pandemic. So this is happening, which I'm sure those people had detrimental implications on their lives, but that's what's happening every day. And this is environmental racism. So we see that there's a direct connection between environmental racism and COVID-19. And I want us to really lift up that issue. I want to bring a specific example of something called endocrine disrupting toxins. And that's what we're seeing in terms of what's being exposed to us in the community. There's a body of evidence that's emerging, but mostly man-made. A lot of people are starting to just ingest this through the air, food, and personal care products. And the bad thing about this is that EPA does not regulate these. In fact, the treatment plants are not able to even treat them. And so we're exposed to that. And what that does to us for our health is we're now exposed to chronic conditions. We're creating chronic conditions irregardless of our decisions. So we're exposed to this, and now we're fighting against that predisposition before COVID-19. Okay, so that's a problem. So the question I want to share, some information I want to share is, what can we do? To Yvonne's point, continue wearing personal protective equipment and social distancing. Continue going, despite what the states are saying, despite what they're saying, to go back to work. If you have the ability and you have to go back to work, still cover your face. You still practice these measures, right? Because the most vulnerable people ourselves are at greater risk for infection and health. And keep in mind, if you decide you're going to quit your job because you want to make that personal decision, you probably won't be eligible for unemployment benefits. So while you're trying to make the right decision to protect yourself, the system is saying, yeah, great job, but we're not going to actually support you because you quit voluntarily. So keep that in mind. Continue stocking up on food supply. We're probably approaching a food shortage, and they're starting to talk about it a little bit now. So I want to encourage us, particularly when you're hearing about Tyson and Smithfield Foods, to really think about how there's a food shortage coming and continue to stock up, and maybe even use this time to explore plant-based substitutes, because we know meat, it's arguably unsafe at times, but maybe use this opportunity to explore different options. As a public health professional, contact tracing is key. If you feel you've been exposed to COVID-19 for any particular reason, and you think you've been exposed and you have a public health professional approach you, participate, let them know who you've been in contact with. It's anonymous. They've only contacted if you're the one that's been exposed to that particular person, but definitely don't let your personal bias against what's going on with the government stop us from trying to track this disease down. It's extremely important that we do that. And if you do feel you've been exposed, just maintain social distancing and at least 6 feet for 14 days. So I want to get to my conclusion here and say that what we need to do, we need to advocate for policy. Reverend Yearwood had a fantastic opening. He was talking about EPA, and yes, they rolled back a lot of their regulations, which mean that we're now exposed to air that's going to increase our likelihood to get exposed to anything in our lungs that's going to increase our chance of getting COVID-19. So if you're not already in some kind of organization, I saw NAACP, the Solutions Projects, and I even want to lift up Black Pearls, because all of these organizations are doing things to address structural racism, which is the root of the problem. The Clean Water Act, Safe Drinking Water Act, National Primary Drinking Water Standards, the Clean Air Act, maximum contaminant level, all these are directly related to policy and related to our health. So it's important that we become aware of what that is and get more involved with people who are actually in those positions. And I wanted to end by saying that we need to advocate for tighter regulations and a cleaner society and cleaner energy. And the reason why that's the focus is because if another pandemic comes, we at least not being created, we're not being set back before the pandemic hits again, if that makes sense. We need to be a little bit more on top of what our policies are doing. So this is just an overview of what we discussed. And I want to say lastly, before I end, that we need to be careful not to create our own systems of oppression within the system of white supremacy. What I mean by that is, don't create false messages within ourselves. If we know we need to do something, we need to go forward and do it. We had some great recommendations earlier, but don't get too caught up in historical connections with the government, because while those things are true and valid, we have to make sure we're protecting ourselves in the process. Thank you so much for your time.
Man, great information. Y'all are definitely tuned in to the Hip Hop Caucus Rona Roundtable, and we are getting it in. You just heard from some health professionals giving us what we needed to hear, and we're going to continue to give you more of that. So we have a particular question that we wanted to ask you all, because we want to know from you. We want to hear from you, and we want to kind of like hold a question to you. And we want to know, what do you believe your community is most concerned about as it relates to COVID-19? That's the first question. That's a polling question. If for those that are on Zoom, you should see it pop up on your screen. And it says, what do you believe your community is most concerned about as it relates to COVID-19? So here's a couple of things we want you, those that are actually on Zoom, we want you to take a moment and look at that question and check the box and submit. And we want to collect that data, and we want to know so we can share that with everyone later. And we can start doing more to get answers to that particular question. While we're waiting, as you're taking that poll, I do want to go back and as a question each. Yvonne or Crystal, either one of you can take either question. But the questions on our chat, there were two different questions. One question spoke on the importance and what is the importance of nutrition as we're in COVID-19. And the other question is if you have tested positive for COVID-19 and you quarantine yourself at home for the required amount of time, how many times should you go back to get tested to see if you come negative before you go back to work? So there's two different questions for Crystal and for Yvonne. And once you all answer that, we'll move quickly to our next panelist.
Yvonne, I can touch on the nutrition aspect. I think it's extremely important. We're sitting here, we're sedentary, we're probably doing a lot of stress eating just to cope with it. I think now is the time to be more just intentional about what we're picking up at the grocery stores, really trying to create a healthy lifestyle, because we don't want to stock up on these processed foods and we're sitting and we're gaining weight and we're gaining stress. And it's just not a good combination. And then your mental health might set in, and that might even lead to depression. So I want to just challenge you to buy healthy foods, put it up front. It's more important now probably than ever.
And I would like to talk about the person that has had COVID-19 and has quarantined and recovered and getting retested. One of the big problems we have is that testing is not the same everywhere. The accuracy of tests are not the same. We don't know if you indeed get immunity once having had COVID-19 and growing those antibodies. But I would say advocate for yourself. If you feel that you're not getting well, you need to be persistent in seeking care, because at these times, we usually bring somebody with us when we enter the healthcare system to be our advocate. Well, we don't have that luxury right now because of the strict visitation rules. So I would just encourage you to keep advocating for yourself. If you know your body and you know it's not right, then seek care.
All right. Thank you all. And we're gonna do the crowd goes wild. Thank y'all. Okay, we do the hands. Okay. We want to thank our first two panelists with that wonderful information. We greatly appreciate your time and your commitment. And once again, you're tuned in to the Hip Hop Caucus Rona Roundtable. Check us out, hiphopcaucus.org or think100climate.com, think100climate.com. So we want to move right along. One of the things that we at the Hip Hop Caucus definitely say, we say can't stop, won't stop. And we also say we're from the streets to the suites, meaning that we work with the people on the ground as well as shape policies on Capitol Hill. But one of the things we want to talk about now, we're not an organization that's top down, but we're bottom up, meaning that we're with the people, on the streets with the people. Our president, Rev Yearwood, always says we're post-partisan, not just non-partisan, meaning that we're after the cameras, we're after the vote. We stay consistently on the ground. So with that, we're going to talk about community resilience. And we have one of our own Detroit Leadership Committee members straight out of Detroit, where we know Detroit was being and is being hit hard. But the community says, yeah, we may be catching it, but we're going to fight and we're going to help the community. So we brought on our brother Jerome Record to talk about what the community are doing, some of the things that they're doing that he can share with those that are watching, that maybe you can take this format and go as we're watching people supporting the people on the ground that need resources, need food, and different things that they're doing. So we're going to turn it over right now to our next panelist, Jerome, straight out of Detroit. Thank you.
Good evening, everyone. I just want to say thank you to the Hip Hop Caucus and to the Reverend Yearwood and all the participants that are here today, just for putting on this forum and allowing everybody to come together in this collective space to really talk about really, let's just put it like this: what the new normal is going to look like as we potentially move forward. Just a little bit about myself. I'm a proud Detroiter, third generation. Really just living out the dream of an individual growing up in the city of Detroit, seeing the blight, seeing just how unsanitary things were, and just as a kid, knowing that this isn't normal, that this isn't right, and somebody should be doing something about this. And it really started to drive me to volunteerism and learning the importance behind that, civic engagement, and really the power that comes behind when the community works together, and what we can really achieve. There's a lot of information. There's an organization I'm working with, the McKinney Foundation, that really has a lot of analytics and data that supports how volunteerism in communities presets the local government. And I really think at this particular time that that's something that we're kind of forced to go back to, where the individuals in the community are now stepping up and utilizing the resources that are around them in a collective space to kind of create that security and sustainability in their neighborhoods, in their boundaries or cul-de-sacs or whatever it is. And we've been so far removed from that because we live in our cities, and we got so much going on within our lives, and not to mention the whole social media and technology boom that really just preoccupies us mentally so much, that we kind of got away from nature and getting back to connecting with each other in the community. I mean, if you really think about it right now, most folks prior to this, weren't neighborly, didn't talk to their neighbors, didn't care to talk to their neighbors. Right now, this is a situation that's kind of forcing us to talk to each other, to see what's going on. Knowing who your seniors are in the community, seeing if they need help with food and groceries, and getting their prescriptions filled, helping them maintain their lives. Those are the things that we as a community have to do. We can't expect local governments and state governments and federal governments to get down into the crux of those issues in our households. That's something that's our responsibility and obligation. I'm a 40-year-old male from the city of Detroit, so I'm my 80s baby. I'm the Eddie Haskell era, helping the old lady across the street. I was raised in that era, and we're supposed to take care of our seniors, and these are things that were taught to us. I had a grandmother and a great grandmother, just due to how our communities are structured now in our households. We don't really have that structure anymore. We're kind of unraveling in a downward spiral and not in an upward spiral. And the community is I really believe is going to be that main component that's going to really bring that essence back into the households, bring that essence back into our daily lives by we continuing to cultivate spaces like this. I put a couple slides together just to really talk about what community resilience is. Just started with some basic definitions of that, just for people who aren't working in our arena. And I really just want to break this down to a basic level so that anybody that's listening to this, whether you work in civic engagement and nonprofit arena, you're able to hear this, be inspired, and know that there's an outlet and there's resources that you can go to help you with information. There's nonprofits, block clubs that are looking for you to say, hey, how can we be of any assistance? How can we help you organize and come together and create something that's specific to your community and your boundaries? And those are the directions that we're moving in. That's something that's one of the main focus and passions of S.E.E.D now, which is a 501c3 that's really focused on seeding communities with this type of information, where we're building viable ecosystems, whether it's a food ecosystem or it's a jobs without barriers, workforce development type ecosystem. These are the types of collaborative work environments that we're looking to partner with, whether it's another nonprofit, the city, the state. We want public-private partnerships, utilizing servant leadership across the board. But I'm not gonna hold you guys any further. I'm gonna share my presentation with you all. Hold on. All right. So again, S.E.E.D Now is our nonprofit. It's a 501c3. Started with my wife and myself and a couple other influencers from the area of Detroit, East Side, 48234, bordering 48205, which is notorious for just about anything on a negative aspect, just because of the pure size of that particular area. So we border a very, very, very hard hit, destitute area, riddled with a lot of crime, abandoned homes, things of that nature. And we wanted to provide some type of relief when that element approaches upon our boundaries. We wanted to be able to have open arms and provide people with some type of resource, and really just naturally providing resilience is really what we're doing and what we're really about. You know, Detroiters, we have a cocky swag about ourselves. You know, you knock us down, we're gonna get back up. We're gonna continue to keep fighting. You know, and I'm gonna speak for Detroiters in particularly because that's what I know, that's where I'm from. And we're no different than any other urban community. If we can do it, you can do it as well. And we're looking to partner up with people that are looking to give back to their communities, to see the community that they want to see. You know, not accepting what's around us, as far as the blight, as far as the unsanitary conditions, the spoiled food in the stores and things of that nature. We can do something about that. There's other communities, there's other countries with less resources than we have that are sustainable. So when you really look at that and compare that, there's really no excuse besides someone stepping up, putting a structure together, and, you know, people being inspired and falling in line and making it happen. So what is community resilience? I'm going to read off these sheets just for anyone that are listening and can't see what I'm seeing. But community resilience is a sustainable ability of a community to use its available resources. So we're talking about energy, communication, transportation, and food to respond or withstand and recover from all adverse situations. So for example, economic collapse to global catastrophe or risk, i.e. COVID-19, something that we're dealing with now that's really forced everyone to stay at home. We have to reevaluate what we considered as normal and moving forward, how we have to do things now. I mean, I know if everyone goes outside, what you're going to see that's different. Everyone has on masks and blue gloves. That's not normal. But we're moving into a situation where we're going to have to create the new normal. So this also allows for the adaptation and the growth of a community after disaster strikes, hence the mask and the blue gloves. Communities that are resilient are able to minimize any disaster, making a return to normal life, or what we would say the new normal, as effortless as possible. By implementing a community resilience plan, a community can come together and overcome any disaster while rebuilding physically and economically. Why is community resilience important? So resilience is essential to our existence for several reasons. It allows us to develop a social blueprint for protection against experiences which could be overwhelming. It could provide us with help to maintain balance in our lives during difficult or stressful periods, and also protect us from the development of some mental health issues and difficulties. Where do we start? Understanding that resilient people do not wallow or dwell on failures. They acknowledge the situation, learn from the mistakes, and move forward. This is how, and this is why it's so important that we continue to have these types of collaborative spaces so that we can, again, not wallow and dwell in the situation that we're faced with, but acknowledge the situation, come together and learn from it, and then start to move forward. And that's why this is so important and vital that we're doing this. So again, just hats off to the Hip Hop Caucus, Rev, and all the other participants that are here this evening. How do we do this? as I stated, we do this by organizing in our community. First off, setting some type of a meeting structure where you can start to discuss what type of resources that you have in your area. Are you by a train station? Are you by water? Do you have a lot of land? Do you have access to abandoned school buildings or commercial buildings? Do you have access to food? These are the things that you and your community and the people that are like-minded need to talk about. Set some type of meeting structure where we meet on a regular basis to talk about this. Elect officers in that particular structure. Organize a community event to connect with other residents and say, hey, this is what we've came together with. We meet this particular time. This is what we're thinking about doing, and this would be good from the community. We need your support. In that process, creating a welcome pack or a community action plan. So when you do engage with the people, you can give them something tangible that they can go home, look at, read, be inspired by. What about money? You know, I know that that's another question that's going to come up. You know, definitely dealing with people from a 0 point, there's not going to be a lot of resources. So understanding that block clubs, neighborhood associations don't have a lot of money and resources off top. So as a community, residents will pay a monthly due to ensure that specialty services are provided within their boundaries. So what I mean by specialty services, mobile patrol, you can provide your own security, volunteers. This is also a good way to help with the seniors and senior isolation. You know, we call them, as far as the city of Detroit, they call them ride-along. We have a lot of mobile patrols across the city right now, and it kind of works in the blockchain effect because you're connecting with other boundaries, and we are able to cover the community in a fast way. If something's happening, we're able to get information out. Snow removal. A lot of urban communities don't have the infrastructure to where the side streets and a lot of the neighborhood streets aren't being removed. If you create and organize within your boundary, you can contract services out for someone to come and do those things for you. Leaf removal, lawn care, food services. These are all things that you can organize with the people in your community, and through volunteerism, create a blueprint for sustainability, which could potentially lead to economic things as well. There's also grants that can be obtained on a local, state, and federal level. You can also utilize some crowdfunding sources through social media as it pertains to getting funding and resources for your ideas or your projects that you're looking to do in your community. I think that's really it for me, just closing things out. My information is here. You can reach us at www.SEED.org. You can also connect with us through the Hip Hop Caucus. Again, I'm here for information. And that's it. I just want to say thank you to everybody for giving us this opportunity to speak. I hope that this information was definitely helpful and we were able to inspire individuals and other communities to take action.
Man, I know y'all enjoyed that. And we're pulling together community resilience, making it happen. And, you know, I always break down the word community, common unity. And right now we all have a common global unity, and that is dealing with COVID-19 and trying to make sure our communities are safe. I did see our shout out to one of our hip hop fellows, Messiah. He said, keep making sure you exercise and build your immune. Take some black seed oil, making sure that you're stretching your body. So while we're inside, don't necessarily let your body go down. We want to make sure you're stretching, building up your immune system. Breathe some air, get some vitamin D so that you can get some life into you. And this panel is bringing life. And you are tuned in to the Hip Hop Caucus Rona Roundtable. You can check us out at hiphopcaucus.org, think100climate.com, and also it's voting season. Check us out at respectmyvote.com. That's respectmyvote.com. But we're moving along. We got our next two panelists. We thank Jerome for that. Everybody's in the chat trying to get to you, Jerome, so make sure you make those contacts. But I want to come to this next part, and this is a serious part that I really want us to take some time with. Or really pay attention to, because for me, I've lost a couple of people to COVID-19. I literally saw one of my friends lose his father this morning, and got a call to raise money to help someone bury their mother because of COVID-19. So our mental and emotional health is very necessary and very critical. The Hip Hop Caucus is here for you. We love you. We stretch our arms out for a virtual hug to make sure that you're feeling it. But we brought two dynamic sisters on this. Yes, I saw you, Chevonna. We brought two dynamic sisters on here to talk about our emotional and mental health. And we want to bring them on now to give us some words about that. So I see Dr. Shamell, your queue is already open. So we want to go ahead and let's talk about it.
All
Share
right,
with
y'all.
us.
My name is Dr. Shamell Bell. I am a mother, community organizer, and professor. But I am also what you all described as a healer. But I must be honest, I was like, I'm on a healing journey towards self-care alongside others, you know? And it really took a little bit of me to like, almost didn't share it because I was like, I'm not healing nobody. I'm trying to heal myself, you know? I can't heal myself and try to heal others at the same time, you know? But I now, thank you for putting that on there because someone definitely told me like, what? You are a healer. And I think I embodied that when, in that moment. So I want to thank y'all first. And it was something that we opened up with and those powerful words around self-care, which is what I usually, when I was organizing with Black Lives Matter Los Angeles, that's what I always focused on. And at the LAPD headquarters, we were camping out for the death of Yvonne Ford. And one of the days was just like, I'm so tired of constantly being in a state of mourning, and I wanted to live as resistance and live in this space. And I didn't know what I had to give. I didn't know that I was going to be an organizer. I just know that I had to get out into the streets. And then I said, I've been a dancer and choreographer all my life. I've been dancing. I was a Black beauty pageant person, y'all. 2 years old, I was like the black little John Benet Ramsey or Tyler and Sierra's. Oh, that was me. And so my thing that I liked about it, the only part was when we got to show our talent, and that was dance for me. And so that's what I did at the LAPD headquarters. And so I embodied or channeled what was called street dance activism. And that's when the police officers actually got more afraid. They were like, they dancing? They experiencing joy? Literally, you could feel a shift. The vibrations literally shifted. And me being someone that's now identifying what it means to be a clear, cognizant person, and these are terms that we can talk more, but I just know things through my body and I know things through my feelings and emotions. I could feel how we shifted. And so that's where street dance activism came from. So I want to share with you all, everybody get up. Yes, get up. Everybody, come on, you got to get up. If you're able. We're not gonna do a whole choreography, y'all. I just want to get y'all in your body, right? We're gonna do an embodied check-in, all right? So first, what I want you to do is plant your feet on the ground, and we're gonna honor the ground that we're in, right? Honor the land. Close your eyes. Everyone close your eyes. Everyone. And we're gonna take a breath together. Because the root of the word conspire means to breathe together. So just close your eyes, follow your breathing. Is your jaw tight? Move it around a little bit. Everyone's eyes closed so you don't look silly. Is your tongue at the roof of your mouth? Move it around. Move your shoulders back and body. Move your shoulders up. All right. Now I want you to take a breath in, breathe it in, hold it, breathe it out. One more breath in and breathe it out. And on this last one, breathe in as deeply as you can, breathe it in, hold it, and breathe it out. Now open your eyes. Now I want to do something that's called an embodied check-in in the chat. So a lot of people are not talking about how they're feeling. It's just like, how are you as a salutation, right? I'm okay, if they even say that. It's just, have you noticed if you said, hi to someone, they're just like, you say, hi, how are you? They're just like, no, I'm waiting for a response. They're like, what do you want? I'm like, I'm waiting for you to tell me how you're doing. Like, I genuinely care. So I do this quick exercise in self-care called an embodied check-in. So I want you to, the chat, say your name, and I want you to say your pronoun if that is what's fitting to you. And I want you to say how you're feeling really, like really, how you're feeling. And then what I want you to do is give me a one-word affirmation. I am, mine is love. So in the chat, your name, your pronoun, how you're feeling really. One sentence, it could be 3. You can keep going while we're doing this exercise if you want. And then I want you to say an affirmation. I am, and what you are in a positive. All right? And then the very last thing I want you to do is your favorite dance move. Yes, oh, I see you over there. Hey, 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 hey. So mine, so I'm gonna model it for you. Hi, I'm Dr. Shamell Bell. My pronoun is sis, as in sister. I like to be called sis. Yes, I make my old white professors at UCLA call me sis. It's hilarious. They're like, hey, sis. And I am feeling so much energy from all of you. And so grateful. I'm grateful that we can be together in community during this coronavirus moment and dream and imagine and learn to be, I don't really want to be resilient, but know that we have already been resilient, and knowing that we always been okay and we will always be okay, because past, present, and future all occur right now, and in this moment we are free. All right. And so the last thing I want to show y'all is, who knows this? Yes, who knows where that's from? New Edition, If It Is in Love. That's my favorite dance move right now. I don't know why. It's like stuck. If it is in love, why do I feel this way? Why does she stay on my mind? All right, that's our embodied check-in. And I just wanted to, I'm gonna bring the computer back to me. I'm grounded, and my mom made me a Zen room, by the way. So she created this space. So I'm outside in her patio in my Zen room. There's waterfalls and all types of stuff. But I want to talk to you about the difference between self-care. Something important that we talked about, I think it was Moving Forward Network earlier in the chat, said collective care. And I was like, yes, self-care, community care, and collective care. They're all intertwined, right? So it's not an act of, feeling like self-care is selfish. I used to be on the ground of BLM, and some people were just like, self-care is selfish, and then now we have this shift where I had this vision one day that I was running into, like Baywatch, into the water. Let it be known, I cannot swim, y'all. I can't swim. But I was jumping in to save somebody that was like, and so I go and I try to get them. So what do you think I'm doing? And then the lifeguard is sitting there on his post, looking like, stand up. I stand up, the water's coming right here. The person that was didn't even want to be saved. They wanted to continue to be reactionary. They wanted to continue to be in their trauma. They didn't want to look at themselves. They liked being here, right? And there I was trying to go and save someone that didn't want to save themselves, right? And here I am drowning. But then we pivot in the dream. And in that dream, I saw myself as a lighthouse. Like my body was in the form of a lighthouse. And from my heart, it was a light that just shined. And then there was a boat that came to safety because they saw my light. And I was like, oh, that's deep. I'm not a lifeguard. There's people that do that work though, that can actually swim. I'm a lighthouse. And trust me, I know I need to learn how to swim. But yeah, I just want us to be thinking about self-care and collective care and what it means to us being in our full power and being healthy, and how that creates this opportunity for other people to see our light and be alongside the journey, right? So I want to introduce to you all my favorite expert, Dr. Chevonna. I call her doctor, but you know, Chevonna is amazing, and I just want her to answer a couple of questions. Well, just one major question for me in the time that we have. Chevonna, you have been there for me in my mental health as I, you know, have been a mother, a PhD student, and an activist all at the same time. I know I've called you and like, can you talk to me right now? And you have talked to me. So first I want to say that for me, self-care is different from being a mental health expert. So anytime I come and I talk about self-care and mental health, I will always bring you with me. You're on a panel in a couple, like maybe in a month, you know, with Future X Sounds, and I'll share the information for that. So I just want to ask you a particular question, and that question is, what are some emotional concerns that our community may be vulnerable to during this time? That's what I want to ask you.
Well, it is my absolute honor. Thank you, Shamell, Dr. Shamell, and the rest of the team. And like she said, I'm Chevonna, and therapy is my gift. I'm literally a servant. All that stuff on the resume, that doesn't matter. It's my gift, and I'm blessed to be able to do what I put on this earth to do, and that's what I do every day. So in many different capacities. But in our community right now, that gift is needed. And so there are three major concerns. Mind you, there's a lot more, but I want us to focus on three concerns in our community. There is depression, anxiety, and PTSD. So for depression, I want us to think about the fact we're dealing with grief. And also, we don't have access to the things that usually lift our spirits. One of my roles is being a psychiatric liaison in an emergency room, a hospital emergency room. And every night I have people coming in with suicide attempts, especially people in our community who are saying, I usually would go to the beach. I usually would play basketball. I used to hit the gym. And they are struggling, like, I can't do the things that I need to do. Now for us, for our people, we're communal. So our people, I worked with a young lady today who was like, I can't go see my grandma. I'm sad. When my parents get on my nerves, I usually go to grandma's and she makes me my favorite treat and loves on me. And I get to go over there and I can't see my grandma. And this baby girl was crying, just struggling because she can't go to grandma's. So as communal people, we have to be aware of the fact that depression can creep in. Depression can creep in because we don't have that access. And we already talked about the grief aspect. So that's number one, be aware of that, right? And I'm gonna explain to you the difference between feeling a little down and what it feels like to really be struggling with some heavy depression. Okay, I'm gonna get there. So the second one is anxiety. What we feed will grow and what we starve will die. So keep that in mind. What we feed will grow and what we starve will die. So we need to be aware of our fears and be cautious. Like our medical professionals just told us, there's some things we need to be aware of. We have to be cautious, but we don't want to feed the fear. Be aware, be cautious, but don't feed those fearful thoughts. Now, that's darn near impossible right now because everywhere we go, fear is inundating us. Fearful thoughts, fearful talk, fearful everything is all around us. What we have to do is find that light, find the lighthouse, right? And we have to look to that light. We have to be intentional about it because everywhere is fear. Fear, because people are capitalizing on that fear, right? So we have to be intentional about finding that light and whatever that light is for you. You're gonna have to watch something silly, dance, put on your music, do those things that make you happy so that you can find your light so we can feed it. Remember, what we feed will grow, what we starve will die. Now, the third thing that third mental health or emotional concern that we have to be aware of is PTSD, right? We have all dealt with some trauma, and that powerlessness, that powerlessness, and I mean, think about it, y'all. How familiar does this sound? My life was forever altered in a negative way. My life was forever negatively impacted. However, it wasn't my fault. It wasn't anything that I did. It was societal concern, societal issues that were completely out of my control that led to me being disparaged. that led to catastrophic issues for me, right? Sounds familiar. How many times have I was just driving in a car being Black and my life was completely altered? So right now you have people in a state of helplessness and powerlessness, and that can trigger some trauma from the past, right? And then we are also dealing with other injustices, horrendous injustices that are triggering more trauma. So we have the global pandemic, and then we have the typical traumas that we already have of just living and existing and being Black, right? So we have that triggers our PTSD. And even though we may not necessarily know that our trauma is being triggered, our body remembers through our 5 senses, right? So you may not even think, oh, wow, my trauma is being triggered. I remember when my cousin was shot when I was 5, and now for whatever reason, this fear that I'm feeling reminds me of that. You may not remember it. However, that feeling of helplessness comes back, and you may remember, your body remembers, wow, the last time we were in danger and we were really helpless was when mom was being beat up by dad. Whoa, okay, let's get scared. Danger, boom. Your body literally physically prepares for danger. Your body remembers through our 5 senses, even if your mind doesn't necessarily remember the trauma. So if you are overreacting, right? There's a situation, a stimulus, something went down, and you are way up here with your response, that's when we know it's a trauma response. If the situation is here, but you're all the way up here, if you happen to go to the grocery store and some lady cut in front of you in the grocery store and you're ready to go to blows, and that's not your typical character, that may be a trauma response, okay? Think about it. When we are overreacting, if your kid left their sock on the floor and you are going completely off, maybe it's not about the sock. Maybe there's a trauma response that's being triggered. So we want to be aware of depression, we want to be aware of anxiety, and we want to be aware of PTSD. So now, I'm not just going to give you a problem without giving you a solution. I'm always going to give you something you can work through, right? So what do we do? What do we do? Hey, honey bun, there's our light. There's our light to turn to. So what do we do when we are struggling with depression, anxiety, or PTSD? We acknowledge it. First of all, we have to be aware of the fact that this is not the way I usually respond. Wait, I'm not usually crying like this. I'm not usually sleeping so much. I'm not usually eating this much or this little. Notice those changes in ourselves. If we're eating more than usual, sleeping more than usual, or like there's significant changes in our life patterns, significant changes in the way we respond to other people. The people that we're on Zoom with, or the people in our life are saying, hey, something's different about you. I see something different. Be aware of it and acknowledge it. Yes, something's going on with me, okay? And then when you go to explain it, use your own words. You don't have to say, I think it's my depression. It's my anxiety. No, something's going on. I'm off, right? I am off. Something is going on, and be aware to acknowledge it. Now, I also want you to look at, how do you know when it's a major issue? How do you know when I need to go and get some support outside of myself? Because a lot of us know what works for us, but because we've been in distress, we lost sight of our focus, right? If usually when you had a really, really rough day at work, you came home and took a nice hot shower, maybe watched your favorite TV show and had a glass of wine, and that worked for you and it kind of charged your batteries, and then you went to sleep and you were able to do it again. Now you're at home and this distress and everything is going crazy. When was the last time you just really took a nice hot shower and enjoyed it? Put your favorite song on and did the things that you know works for you. Because we're in distress, we might forget, you already know what works for you, right? You know what makes you feel good. Think back to, what did I used to do to recharge my batteries, right? So now, I want you to know the difference between a cold and a flu or pneumonia. Now, let me explain what I mean by that, because I'm not one of our medical professionals, but I'm talking about an emotional cold, right? Your friend calls you and says, girl, I'm having a cough, I'm not feeling well. Now, before all of this, you would say, oh, try something over the counter, right? Before this, you would say, hey, have you had some orange juice? Are you sleeping okay? Did you have NyQuil? You try all the things that they could do. You know, get some more rest, drink some fluids. You tell them that, right? Now, if your friend came to you and they look, eyes all sunken, their voice is all scratchy, you see something is off, they're losing weight and they're coughing and they sound like they're coughing up a lung and it's something going on, you're not gonna say, have some orange juice, girl, go take a nap. You might wanna try. You're gonna say, you need to go to the doctor, right? You need some medical help. Why would you say that? Because that's outside of your scope. This regular stuff, like a little cold, that may be okay. You might want to try that, but you wouldn't want the friend or the person that you love to be in danger, and you didn't tell them, hey, you might want to go get an expert's opinion. Now, the same thing for our emotions. You have a friend who calls you and says, I've really been feeling kind of down. That's one thing. Hey, girl, have you tried this? Have you tried that? Or tell your buddy, hey, you know what? If they're telling you I'm really having some issues with my girl, man, it's really a problem, right? You're like, okay, well, you know what, dude, let's talk about it. Have you tried this? Have you tried that? How about communication? You talk to your buddy, right? Now, if they say, I laid hands on my spouse the other day, that's the difference between a cold and something more extreme, right? If your person tells you, I can't get out of bed. I'm just crying and crying and I can't find any joy. I feel hopeless. I feel helpless. Now, if we don't tell them, hey, you might want to get some more support. This is outside of my scope. The same level of danger exists for them, right? If you didn't tell them when they were physically sick and you knew that that can lead to them dying, the same thing emotionally. How many times have we looked up and said, dang, they took their life? If I had known, if I had just said, maybe if they had gotten help. So now, if you see somebody in your life, you'd rather them be alive and mad at you than gone and you regretting it. Send them to someone who can help them. Know the difference between just something over the counter, a little cold, and something bigger, right? And be willing to send them to the support they need. Now, the disparity in our community and us hearing about people discrediting our pain brings back that PTSD. Really? They're talking about it's no coronavirus, it doesn't exist, marching around our capital, right? And what does that remind us of? Oh, wait, our pain is not supposed to exist. Just because we're resilient, just because we're powerful, doesn't mean we're not also vulnerable. And it's okay to ask for help. It's okay to ask for help. And if you need somebody who understands what you're going through and understands and can relate to your pain, ask for it. I was at the psych hospital and I was watching a psychiatrist interview a brother, and he kept saying, I'm Gucci. I'm good. I'm Gucci. I'm all right. And she kept saying, something is going on. The doctor recommended a psychological evaluation. And he's like, no, I'm good. I'm fine. I'm fine. And all I could hear is, this young man doesn't trust this woman. And he was not willing to express what he was going through. Now, when I took the time to call his mama, she explained that he had been having psychosis and paranoid and really was struggling and was in the hospital because he had a suicide attempt and almost had a tragic car accident. Now, he wasn't Gucci, but he didn't trust the professional that he was working with to be vulnerable and say, I'm having a hard time. So I'm telling you guys, if you are struggling with any of those symptoms I mentioned, and you go to somebody and they are not the perfect fit for you, you don't feel connected, you don't feel like you can trust them, find somebody else. Because I'd rather you go through that hunt and be around, because the world needs you. I need you. There are gifts that you have. Therapy is my gift. There's a whole lot of things I can't do. A lot of things I can't do. And so I need your gifts. I need your gifts for me to be okay, because I need the services that you provide and you need the services that I provide. So I'm asking you, I'm pleading with you to be willing to get the support you need so that you can be around, because I need you, okay? And this world needs you.
Thank you so much, Chevonna. And everyone else, I just wanted to thank you. I'll be doing street dance activism actually this Sunday. So if you all follow me on Instagram, Shamell Bell, if you follow Chevonna to know more things about what we're doing. Chevonna, can you tell your Instagram? I was gonna say it, but you can say your own.
Yes, Chevonna, LMFT. LMFT stands for Licensed Marriage and Family Therapist. I practice here in Southern California. Chevonna is Chevonna, and with that unique spelling of my name that I hated growing up with, but now I love it, because if you need anything that relates to me, just go to Chevonna.com. Thank you, Mom, for the unique spelling of my name. Chevonna.com. And thank you all. Thank you all for having me. It is such an honor, and I now feel like I'm welcome to the Hip Hop Caucus family, and you guys are stuck with me.
And everyone, let's take a deep collective breath in. Let's close our eyes and take a breath in. Let's blow it out and open our eyes. and we are complete. Do y'all feel complete?
Oh, I feel good. I feel complete. Man, oh man, I told the team today, I love being part of the Hip Hop Caucus. And yes, you are now officially a part of the Hip Hop Caucus. And everybody that has zoomed in, y'all are down part of this fan. I thank you all. I feel so much better. So, you know, if I was in the church, I'm gonna have to go run through the pews right now. I'm feeling so good. I'm a Muslim and I'm practicing Ramadan, but y'all done fed me. I haven't even eaten yet, but y'all done fed my spirit, so I'm feeling so good, but I will be eating as soon as the Zoom is over. But it is so wonderful, and I'm thankful, and we're getting ready to wrap this up. I just want to thank all of the panelists. Man, y'all gave us so much life, and I'm looking at the comments, and everybody's enjoying this. And we are on Facebook Live right now on our Hip Hop Caucus Facebook page. So if you didn't catch the beginning or you want to go back and hear it again, go check us back out on Hip Hop Caucus Facebook page. And as I said before, you are tuned into the Hip Hop Caucus Rona Roundtable. We are at hiphopcaucus.org, think100climate.com, and respectmyvote.com. But right now, you heard from the East Coast, our president and founder, Rev Yearwood, but now we got to go all the way to the West Coast, to the West Side, LA, to hear from our executive director, who's going to give you some more words, some things that you're going to need to take with you, some directives, some resources. She handles all that, is our wonderful, wonderful executive director. And you know, we talk about culture and we talk about art. She was there in 2014 when we formed our home album, Heal Our Mother Earth. So I love the dance and I love the singing. So Liz helped to pull an album together for us so that we can enjoy life as we do this work of the Hip Hop Caucus. So please welcome our executive director, Liz Halstead, straight from the West Side.
Thank you, TC. And thank you everyone for being here tonight. I'm just going to close us out and really just thank everyone for their presence and give us a couple next steps. Hip Hop Caucus, we are a national organization and our mission is to empower those who are first and worst impacted by injustice to help strengthen social movements, environmental movements, political movements. And I really just want to thank everyone that presented tonight. We had Yvonne talk to us about how to stay healthy and trusted resources we can go to figure out how to take care of our physical health in this pandemic. We had Crystal talk to us about the intersection of environmental health and public health and structural racism and what we breathe and what we drink, our clean air and clean water or lack thereof. That is a pandemic that's been happening for a long time. And this pandemic is now intersecting with that. And how do we address that? How do we be aware of that? Jerome talked to us about community resilience, and is like this an opportunity for us to build things that can actually leave us better off coming out of this pandemic than going into this pandemic. And what does that look like? And Shamell and Chevonna came with us, bringing the how to keep ourselves in a place of self-care, how that translates to community care, how that translates to collective care, because we can't help anybody else if we aren't taking care of ourselves. And the resources, information, and spirit and energy that both you women brought was incredible. And with that, I think the best way that all of us attending can thank everyone that presented tonight is to share with your friends and family, colleagues, neighbors, something that you learned tonight, something that served you tonight. Share it. And you can do that by picking up the phone and talking to someone, FaceTiming someone. As TC said, you can go to our Facebook page, Hip Hop Caucus's Facebook page, and share the video. I think we'll take some highlight clips and put it out on social media. You can share those, but just take what you learned and share it with others. And that's the best gift that you can give to everyone who gave to us tonight in their presentations. With that, I'll hand it back over to TC, but thank you all so much.
Man, this is wonderful. I thank you all. And I got to shout out the East Coast and West Coast, rest of our team, Jasmine Williams in our LA office. Man, Jazz, thank you, thank you, thank you. Jazz is the bomb. She's the poet, director of operations out on the West Coast. And then Mark Antoniewicz in DC, in our DC office. Yeah, we bi-coastal, y'all. We do it all. Mark Antoniewicz, our director of communications, doing a wonderful job making sure. Big ups to all of our partners, all of our civil rights organizations, political organizations, our climate organization, environmental justice organization, and really most important, you right there on the ground that's in that neighborhood. We thank you. No, we couldn't answer all your questions. No, we couldn't get to everything, but we wanted to give you something to let you know that the Hip Hop Caucus is here for you, and we will be here for you. So remember, hiphopcaucus.org, think100climate.com, respect my vote. Thank you all. It's time for me to eat. Have a good night. Peace, y'all. Do your favorite dance. We out of here. Ah.